Hello and welcome to What's Happening at Tri-City Medical Center. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. She is here today to talk about women's health after menopause and the MonaLisa Touch treatment. Welcome, Dr. Penvose-Yi. I like saying your name.
Thank you.
This is very nice.
Nice being here.
So the MonaLisa vaginal laser.
Right.
What is that?
So just like we laser our face to get the tissue healthy and elastic again, it's actually a laser that goes in your vagina and the outside of the opening to the vagina that gets that tissue healthy again and gets it elastic and gets the hydration back to it and the.
I'm looking this way because whenever I hear laser, you hear about laser this, laser that, and I'm like, do I want a laser? Because you're going to go inside there.
Right.
You know?
We like to think of it as light energy in the vaginal tissue that it's kind of like a small local irritation that causes our body to say, hey, what's going on there? And then it sends all of our helpers in to re-stimulate natural, healthy tissue growth.
So this laser treatment stimulates your
fibrin and your elastin to regrow in that area. So before, when the tissue is dry and unhealthy and low estrogen, that type of healthy tissue just slowly dissipates and isn't there as much anymore. So the tissue's dry, it doesn't stretch, it tears easily. It's not healthy. So just like, as we age and our face loses that elasticity and things seem a little saggy, and that's the other thing the laser can do for tissue that's gotten stiff and non-flexible. It can give that elastic back to make things more malleable and more comfortable, for example, with intercourse. Same with our face. We want it to be tighter and lift. We want that vaginal tissue to be responsive like that too.
So not only will it help with the discomfort that may come from vaginal dryness, it also will help, are you saying, to tighten the area?
Yeah, so it's interesting, right? So we say it makes it more comfortable to have intercourse in that it makes the tissue more elastic and accepting, but at the same time, some people actually have gotten tighter from the tissue drying out, and so that makes it. So it can be tighter, we have a lot of babies, it gets a little looser, it can tighten it up that way. And at the same time, it can also make it more elastic so it can open up as well.
Who can qualify for this treatment, or is there people who don't qualify for this treatment?
So really, the only people who can't have the treatment are people who've had precancerous changes in that area. Not abnormal pap smears. Some people think a history of abnormal pap smear is a reason you can't have it. If you didn't actually have cervical cancer and certain kinds of treatments, such as radiation treatment in an area. But if somebody has vulvar neoplasia or vulvar type cancers or precancers, those are people who are not candidates for it. But it doesn't actually treat right on the cervix. It treats the vaginal tissue. You can have this if you've had a hysterectomy or not had a hysterectomy. You can't have it if you've had vaginal or pelvic radiation for any reason. So if you've had certain types of cancers that you've had pelvic radiation for, you can't have it. But in short, most people can have this treatment. Most people are candidates for this treatment.
And how I have never heard of this treatment myself. How does one come to know about this? Do they go to for a woman who's like, I don't know what's going on, I feel like something's going on, do they get referrals from their primary care provider at Tri-City and they're recommended, or
they absolutely can. Some people can search the net. There's a MonaLisa Touch website. You can check and see all the providers in your area. I get a lot of referrals from primary care doctors. I like to go out in the community and do educational seminars on menopause in general and vaginal atrophy and just give a woman a chance to talk about it. I do, for example, breast cancer survivors, it's a big problem for them. A lot of the medications they take are anti-estrogens. So they may be very young with breast cancer and then their body in certain areas, like their vaginal tissue, becomes menopausal-like. And so I'm starting to try to reach out to all those groups to make it a known thing. It's definitely becoming more common. When I first heard about it, I was super excited because I'd never seen anything like this. And it's such a great idea because it's an area in medicine that I wasn't always able to fix. I wasn't always able to fix the tissues with vaginal estrogen or over-the-counter lubricants, or some women couldn't have the vaginal estrogen, or even if they technically were cleared to have the estrogen from their cancer doctor because they had breast cancer or ovarian cancer, they were afraid to do it, and they just really didn't want to run that risk at all. And so now I have a treatment option for all these women that we didn't think we had an option for in the past.
And what's the recovery time for something?
That's the other really cool thing about it. The treatment itself doesn't hurt. You don't need any numbing medication or anything in the vagina. So you just feel a vibration. And I am menopausal and I have had it done. So I am truly speaking from experience. Yeah, just little vibration, and it's just a few minutes, and it just treats the tissue circumferentially. And the external part, we put a numbing, we call it a BLT, topical benzocaine, lidocaine, tetracaine, but a BLT ointment on the outside. It sits there for 15 minutes before the treatment. And that's for the vaginal opening, and then the tissues on the outside, because that's a big area of pain with intercourse. And then we wipe that off after 15 minutes. People do not feel a thing. If for some reason there's a little breakthrough area, I always say like a little rubber band snap. In one, it's like a quick second, and I felt that. So, but it's pretty rare for them to even feel that. If they just get an internal treatment, 24 hours later, they can have intercourse if they want to. If you get an internal and external treatment, 1 week later, you can try intercourse if you want again. And again, like we've said in the past, intercourse isn't the prime goal for this. Some people will experience a relief of bladder symptoms within a week of the first treatment.
So you're saying by doing this MonaLisa Laser Therapy, it can also help to your
bladder. Yeah, so people, when I was newer to the treatment, and we knew it could help with bladder symptoms, but we were initially more focused on pain with intercourse when we were newly advertising it and learning about it. But what we found is almost everybody was coming in and saying, I don't get up to go to the bathroom at night anymore. Like, huge, it's huge. I sleep through the night, including myself. I was up 2 times a night before the treatment. And then now I sleep through the night. It's great.
Now, do you have to, or maybe every body is literally different, do you have to keep going back to keep getting rejuvenated?
Right. So the standard treatment is 3 treatments, 6 weeks apart. I have found for women who have more of a problem because it's been a long time since they've had treatment for this issue, I have done a 4th treatment for them. And some of the external treatments require up to 5 treatments. But after that initial treatment,
the first one,
the first 3 treatments or 4 treatments, then you just come back once a year for a maintenance treatment to keep the tissue. And I'm finding, as I'm starting to have the women come back at the 1-year visit, they're just starting to know some of their symptom return maybe a month before the visit, and then they're getting the treatment, and it's holding them for that year.
Okay, and so the procedure isn't painful,
correct,
and you can return to normal activities?
Literally, if you want, we have to do ice. If we do an external treatment, we do ice for about 10 to 15 minutes after the treatment. And then you could go back to work if you wanted to. I personally say that's always a good reason to take the afternoon off, to have a little something for yourself, go home, watch a movie, have some time to yourself. But really, if you had something to do, you could. A good story for our office is 2 of us had it in the office, including myself, one day, and we ended up taking a walk, and it was a New Year's Day for some reason. I don't know how we ended up doing this, but we ended up walking from Carlsbad all the way down to the Oceanside Pier, and it rained. Not supposed to get wet after, but it happened, and I did fine. So, but we joke, you can go walk, I don't know how many miles you think that is, I don't know.
Well, thank you so much for joining us, but before we go, where can they find you in this MonaLisa Laser Therapy?
So I'm with Radiance OB-GYN, and we are literally within walking distance of Tri-City Medical Center.
Dr. Penvose-Yi, thank you. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.